Teresa B. Johnson Alexander, hyphenated baby. What's the best natural remedy for getting uric acid from your body? There are diets that literally, uric acid is a byproduct of muscle metabolism. And uric acid is in everybody's body. When you start to accumulate uric acid, it can cause a condition called gout. If that gout, as uric acid is floating around, it's fine as long as it's in solution, in your bloodstream, and it's dissolved. If it comes out of solution, then it becomes like little shards of glass. And so the most common joint that it affects is the joint behind the big toenail. So right at the joint of your foot, right at the bunion area. That is the most common, but it can affect any joint. It can affect the knees, it can affect the hips. So you can have that problem. You can have a gout attack in any joint of your body. But again, because of the daily trauma on the foot, and if you're right-handed, use it to the right foot. If you're left-handed, use it to the left foot. Why? Because those feet, you take your first step on your last foot and your last step with your dominant foot. So guess what? It's got more miles on it than the other foot does. It's got more wear and tear. So that's one of the reasons that it's more susceptible to it. So there are things that you do, things that some people do that they make a mistake in doing. It's diuretics, things that can make you diuresis, like coffee, like alcohol, etc., will make the uric acid crystals concentrate more, come out of solution, and cause the problem even more. There are a couple of prescription medications, allopurinol, which is great. It makes you urinate out the excess uric acid, and one called febuxostat or Uric. Uric is absolutely amazing. Now, there are three types of arthritis: rheumatoid arthritis, osteoarthritis, and gouty arthritis. Osteoarthritis makes the joints inflamed, they hurt, but they don't get any real damage to them. They may swell a little bit. It's not a big deal. Rheumatoid arthritis is an autoimmune disease. It can damage the joints, but gouty arthritis can destroy the joints. And that's when you get hands look like this, and you get feet that one toe is at a 45-degree angle and the other toes are all on different ways. That cannot be repaired. That's just, once that damage is done, you cannot repair it. Now, there are some extensive surgical procedures where they can remove the bad bone, put in an artificial joint, put pins and screws in the feet and everything to try to correct that. But the simple solution, if you have excess uric acid, is to get rid of the excess uric acid. So the thing that I recommend, things like cranberry juice and black cherries are also very good for lowering the uric acid level naturally. So black cherry juice is very good for lowering the uric acid. But I wouldn't play around with that. If I've ever had a gout attack, I wouldn't want to ever have another one. So I would take the medication, allopurinol or Xyloprim or the Uric febuxostat, to just make yourself urinate out the uric acid. There's no side effects to that medication. You never know that it's working. You never know how it's working. It doesn't make you urinate excessively. It's just that when you do urinate, you urinate out the excess uric acid, and that controls that. And there are some people that are genetically predisposed to gout and gouty arthritis. See if either of your grandparents had the condition, or your parents for that matter. Oftentimes, people have chronic disease and they never talk about it. They don't tell anybody what's wrong with them. They just, take their medicines and quietly don't let you know that you could fix this or you could prevent it. You don't have to have what daddy had or what granddaddy had, but nobody knows what the disease states are. And again, I ask, what's your grandparents pass from? What did they die from? I don't know. Old age. That's not the case. Did they have any chronic health problems? No, they didn't have any chronic health problems. They have a heart attack or a stroke. Well, yeah, they had a heart attack or a stroke. They had some heart problems. Or they did have some bypass. They had open heart surgery. Well, yeah, they had atherosclerotic cardiovascular disease, which is a real problem and something that can be avoided if you just know to avoid it and to do the things that prevent it. So great question, Teresa B. Johnson Alexander, hyphenated fem gal. I love it.